NeuroMetrix, Inc. has received a breakthrough designation from the United States Food and Drug Administration, FDA, for reducing moderate to severe symptoms of chemotherapy. This is for induced peripheral neuropathy that has persisted for at least 6 months following the end of chemotherapy. NeuroMetrix's innovative treatment is based on the use of a novel, FDA-approved drug which is effective. This designation will help to promote the use of NeuroMetrix's treatment, which is currently available only through approval process. The primary outcome measure of the study was the baseline to change in the EORTC-CIPN-20. The study enrolled 29 patients who had completed chemotherapy with a neurotoxic agent at least 3 months earlier, had a clinical diagnosis of CIPN, and reported lower extremity symptoms of pain, tingling, numbness, or cramping. The study found that there are statistically significant group improvements in the EORTC-CIPN-20 and other outcome measures, with the relative improvements ranging from 13 to 52%. All adverse effects are mild and self-limited.